I'm here to listen and hope that they'll listen, is because this just isn't going to work.
I'm concerned that they're trying to have a large hospital in Huntsville and a tiny one in Bracebridge. And at best, it should be the other way around because the center of Muskoka is Highway 117.
Well, we're concerned that we're going to lose our hospital. The amount of people that are going to be able to be looked after here is just going to be a little wee thing for first aid as far as we can tell.
Well, I think that we should be keeping a hospital in Bracebridge, not just 12 beds, not just 4 ICU. There's too many people in Muskoka. It's a high seniors area. But I mean, to have to go to Huntsville, people aren't going to be able to get there.
2 people I was speaking to already who have more money than I have already said they're changing their wills. They're not leaving it to the hospital, and they have no one else to leave it to in the family. So
we need our hospital just as much as Huntsville needs it. Both need it. It's not to take one from the other.
While it was an orderly start as these concerned citizens lined up to have their voices heard in the meeting, things turned tense quickly before the meeting even started, as fire code capacity limits meant hundreds were also turned away, something that some didn't take kindly to.
You're not going to let me in when my husband is standing there.
I got anybody? I can check.
I call bullshit. Why are people going through here?
Yes.
It's going to be up to no, they are. Like, I'm not going in there.
Meanwhile, the community voices definitely spoke up following the presentation from MAHC CEO Cheryl Harrison.
There are 300 people that were allowed in this room. There are more people outside. There are people in Bracebridge, Huntsville, all the places that are showing up, and you've consulted with 250 people. I don't know how many were just citizens. You have lots of experts and you need that, but there are citizens who live here, who pay their taxes, who care about the services that they have. And it doesn't seem like you provided them with an opportunity to give input.
People are mad because you're not representing them. You're not doing it on purpose, but you're not showing up for us. Gravenhurst has to go all the way to Huntsville. 30,000 people come on in Muskoka Lakes in the summertime. Reverse the model and give it some true thought.
Well, when we have 39 doctors that signed that document that are furious in regards to it, I went to the doctor on Wednesday, he says he's moving the minute you people approve this plan. Not even when the bricks and mortar start. I use a family doctor.
Even Bracebridge Mayor Rick Maloney weighed in with his thoughts on the model and its impacts on his community.
The plan misses the mark in many areas, and of course has raised a lot of concern and fear that South Muskokans will not receive the quality health care that South Muskoka Memorial Hospital has provided for the last 60 years.
Muskoka District Chair Jeff Lehman, who was also at the meeting, had some thoughts he shared with me earlier today on the planning of this model.
First of all, I think taking the time to get it right, nobody should be hurried into this. If it takes a few more months to get the plan right, then the hospital should take the time to do that. And I'm willing to support that as district chair and push to make sure that we get that time. And I think all the local leadership agrees on that. When it comes to the plan itself, I think even the toughest critics will accept that you can't duplicate everything. It's just not going to be possible with the staffing shortages we see in the healthcare system. And I think MAHC's in a tough spot with the money available. It's not possible to duplicate everything. But this plan has gone a long way in the other direction. It is focused so much of the ambulatory care in Bracebridge and the inpatient care in Huntsville. And I think that's the balance that needs to be better balanced if that can be made to work. And I think the key people on that are who MAHC, to be fair, talked to as part of this process, the doctors, the nurses, the staff, try and come up with a better model that's better balanced between North and South. I think the concerns that the public have expressed are entirely understandable. I mean, I've personally spent a lot of time over the last couple of years, taking family members to hospitals. And when it's a long drive, especially in the winter, it's a real concern for people. So they need to know that care is going to be, that every effort is going to be made make that care as close to home as possible, if that makes sense. And so what that probably looks like in practical terms is shifting some of that balance so that we're not this completely divided sort of model.
And following the meeting, I had an opportunity to speak with Board Chair Maureen Miller about what she had heard from these frustrated voices and what that means for this plan.
We remain committed to finding the best solution for quality health care in Muskoka. And if that means we need to go back to the drawing board to find another solution that fits within the budget and that all of the communities can be happy with, we're happy to do that. But Muskoka Algonquin Healthcare Board of Directors and staff find themselves between a rock and a hard place in trying to satisfy all of the communities to continue to have exactly the same model they have now. We are urgently trying to find a better solution for the future that gives us better quality health care going forward, and we're committed to doing that with the community. If we need to take more time and do more work on it, we're committed to that. You heard MPP Smith tell us that there was some opportunity to have a little bit of time to review this. We are still looking for April-May submission, but we have a meeting coming up on February 20th with all the Credential Staff Association, all of the doctors. We hope very much that they'll be willing to bring their ideas to the table and try and find a solution. So I think there is still a little bit of time. What the community needs to understand is if we miss our time target, it'll be another 2 or 3 years beyond what we were hoping to build here in Muskoka.
Lehman says he believes there's definitely room to make this work without impacting the schedule to get these 2 new sites built.
A lot of work has been done. The commitments have been made to it publicly. And I would like to think that the Ministry of Health will understand some of these concerns and respect the need to take a little more time with the plan.